Daktari, do the measures we have in place, are they sufficient?
Well, I'll give you my opinion, Ollie. I think there are a few facts. Number one is that we are riding the fourth wave. We've seen infections rising very fast because the Delta variant, which is predominant now through sequencing the specimens, is highly infectious and spreads much faster than what we had earlier. This means that the number of people infected is rising rapidly, and the number of people requiring ICU or hospitalization is rising rapidly. The question is, what do we need to do to stop the spread so that we can reduce the number of people requiring hospitalization? I actually think that the measures should have been more stricter than they are. I think that we should have actually considered a much more strict curfew than we have done. I think that in the next 1 week, it's going to be unfortunate that we might have rising number of people seeking care who can't find it because the ICU beds are going to be full. Right now, as we speak, when I speak to many of the colleagues in hospitals, it is clear that ICU beds are at full capacity, especially in places like Nairobi, and Mombasa and other places. You've seen the governor of Kilifi talking about this. So, in my view, there are two levels. The government can issue conditions, which they have done, but individually, we need to ask ourselves, what is our responsibility? So the government can say it's 10 p.m., but individually, as an individual, as a family, as a community, should we actually take a higher threshold for ourselves than the government? That's what we need to do. Because just saying 10 p.m. and then you have a place full of 300 people between 10 p.m. who are crowded in close spaces, in close contact, in a close space for a long time, they are exposing themselves. So in my view, I think that the curfew conditions should have been tighter, probably 8 or 7 or so, to reduce the time that people spend together, especially for the next 1 week. And we will see, we don't know, I mean, the virus has its own life. We don't know how it's going to be for the next 1 week. So I feel like we've been a bit polite. Of course, the government is trying to protect the economy. It's important. And I think every measure is important. I don't think there's an absolute measure. We think that, the more every measure, even if you have 50% of people wearing masks, it's better than 0, but 100 is better than 50. A curfew of 10 p.m. to 4 is better than no curfew at all, but maybe a curfew of 7 is better. So it's about where you dial. It's about what threshold you decide to take. And at the end of the day, the virus will speak for itself.